You know, one of the questions we get all the time is the differences between home health and home care. And that's something that we really should address with more people to help educate them on how we can really help them supplement their home health.
Yeah, because I mean, the goal is that they get the best of care. And the difference is, while in some sense huge, they can very well complement each other. So from my perspective, home health is medical home care. They are likely the most recommended, referred provider for coming out of the hospital or being discharged from skilled nursing facility back home. They have nurses, they have physical therapists, occupational therapists, really any allied medical professional that is necessary to take care of folks.
But don't forget, we can come in, they do those things, but we can come in a lot of times faster and be with the patient as they say leave the hospital and transition back home, so that there's someone there with them to help them to probably keep them from falling and returning to the hospital. And home health then can come in and do their delegated tasks as Medicare tells them, but we can be that constant person with them.
Yeah, well, I think it's an excellent point that obviously we're both very needed entities because of Medicare requirements. Home health is not going to be able to be the constant in the client's life. They're going to come in and provide some very valuable services and deliver a great plan. But we can come in as partners to home health agencies and carry out those plans. So, you know, you remember Dad when he would get a physical therapist to come in, and physical therapist would demonstrate, you know, what he needed to do between that visit and the next visit, and then those instructions would get lost on the pile of things in his end table next to his chair. So had he had a home care person, a personal assistant there with him, they could have worked with him on that plan continually. And guess what? You know, home health is getting their plan carried out in a much more aggressive way. The patient is getting better quicker, and we've been there to help them all along. So.
And then also too, we can pick up things that home health is not able to do, such as helping them around the house, getting them to their appointments, making sure that a first appointment is made after they return home from the hospital. So there's a lot of things where we can pick up from where home health leaves off, and we can continue on and be a constant person to keep the family, the docs, the patient, everybody on the same page.
Yeah, and in our case, we have Jean Ragsdale, our nurse, that can coordinate with the nurses of home health, and not only coordinate the care of the patient through home care, our agency, and the home health agency, but can coordinate things with the physician. So it really makes sense to have that partnership with home health and home care as you know, someone comes out of the hospital or is discharged out of nursing, because the main goal is to keep people safe and make sure they recover as quickly as possible and recover at home.
And to give them that support system throughout their transit.
Yeah. So just a little bit of difference between home health and home care. Steve and Leslie Watley, owners of Home Health Senior Care of Collin County.